let's talk about getting 12 leads, who gets them, and how we're going to do it. Hey everyone, I'm Steve, Paramedic Instructor Coordinator. 12 lead EKGs are a great tool for patient care. Today we're going to talk about who needs to get a 12 lead and how we're going to obtain it. So what is an EKG? A 12 lead EKG measures the electrical impulses of cardiac cells. And cardiac muscle cells are very good at producing and carrying electrical signals. These are then represented on the monitor as waveforms. A 12 lead EKG uses cardiac leads, and we can think of these leads as like looking posts. Each lead looks in a specific direction at the heart. The 12 lead EKG is broken into two parts. We have the 4 lead EKG, which is also called the limb leads. These are placed on the shoulders and the legs. This gives us a view of the heart's current in a frontal plane. Adding the pectoral leads, or the ones that go on the chest, will give us a horizontal view of the heart's current. Adding these two together will give us sort of a 3D picture of the heart's electrical conduction. Damage to cardiac cells will cause distortion to the cardiac waves, and these can be interpreted and read by paramedics and hospital staff. Pathological waveforms on a 12 lead are always changing. They can come and go or morph in shape over time. Early acquisition by the EMT can help capture these waveforms early on so we have something to compare them to. This is because you may be first on the scene and close enough to capture whatever cardiac event has happened. For example, a patient suffering a myocardial infarction may have on their EKG what is called an ST elevation. This is when the rear of the waveform starts to rise in an abnormal way. But this doesn't just pop out of nowhere. This is a waveform that develops over time. So depending on when that 12 lead is taken, you could be in different stages of that waveform changing. Every 12 lead that you take can be compared to the previous one to see what kind of changes are happening over time. Repeat 12 lead acquisition will continue at the hospital. Hospital staff will continue to obtain 12 leads and compare them to see how the patient's condition is changing over time. So who should get a 12 lead? Patients with chest pain immediately comes to mind, but this is obvious, right? Their complaint may be associated with cardiac problems. Patients experiencing chest pain should get a 12 lead obtained within 10 minutes of patient contact. We should also consider patients that have atypical signs of heart attack or show signs of poor perfusion. Patients who have experienced syncope, especially those over the age of 60. Cardiac problems are a common cause of syncope in this age group. Patients experiencing pulmonary edema, stroke, sepsis, abdominal pain, and nausea vomiting should also have a 12 lead obtained. Let's talk about setting up and obtaining a 12 lead. First, let's start with prepping our equipment and explaining to the patient the process and the importance of getting an EKG. We'll start placing our leads by using the limb leads first, and this will get us our 4 lead. The patient will need to remove their shirt and undergarments from the chest and arms. Pants and socks will need to be pushed aside on the lower legs as well. Skin should be cleaned and free of hair. Clean the areas with an alcohol prep pad. A clean surgical razor should be used to remove any excess body hair as it will impede contact. If the patient is wet, bloody, or soiled, take time to clean and dry the areas you'll need to place the EKG. The lead cords should be attached to the monitor and fresh electrode stickers can be attached to the ends of each wire. Be sure the electrode stickers are not old and dry as this can also impact the reading. The stickers are coated in a gel to help with conduction. Once the patient is prepped, it is time to attach the leads. Let's start with the limb leads. We have the white lead, which is marked RA for right arm, the black lead labeled LA for left arm, green RL for right leg, and red LL for left leg. Limb leads should be placed on the limbs. Arm leads should be below the shoulders on the arms and not on the chest. Leg leads should be placed on the inside of the leg, above the ankle and not on the abdomen. Leads should not be placed directly on a bony structure like the ankle. Placing arm leads on the wrist can be easy and provide a good picture, but be cautious as patients tend to move their hands a lot. This can cause artifact in the EKG reading. Now that we've finished the limb lead placement, let's start working on the precordial leads, or the chest leads. After the limb leads are placed, attach the chest leads, or the precordial leads. These are marked V1 through V6 and are colored red, yellow, green, blue, orange, and purple. We'll start on the patient's left with V1 and move to the right towards V6. V1 and V2 are both placed on the fourth intercostal space, 1 inch from the sternum. V1, red, will go on the patient's right, and V2, yellow, will go on the patient's left. The space below the first rib is the first intercostal space. You can palpate and count the spaces between the ribs until you reach the fourth, or if you start at the sternal notch at the top of the sternum and feel down, you'll feel a small step off, and this is called the sternal angle. This marks the second intercostal space. Move down 2 more and you will be at the fourth intercostal space. Again, V1 will be placed on the right 1 inch from the sternum and V2 will be placed on the left. We will skip V3 for now and place V4, blue. V4 will go in the fifth intercostal space on the midclavicular line. This can be tricky as it is assumed that the clavicle ends at the crease of the armpit. It does not. The clavicle extends to the edge of the shoulder. Find the middle point between this and the sternum and you have found the midclavicular line. V4 will go in the fifth intercostal space on this line. V3, green, will be placed between V2 and V4. Next we will skip V5 and move to V6, purple. V6 will also be on the fifth intercostal space. V6 will be placed below the armpit on the mid-axillary line. This can be found by imagining a side view of the patient and running a line down the middle of the rib cage. V5, orange, will be placed in the fifth intercostal space between V4 and V6. Since our leads are in place, let's talk about obtaining the 12 lead. Make sure all the lead stickers are attached firmly and that all the wires are connected to the monitor. Ask the patient to lay supine and remain still. Movement can distort the reading and cause artifact. Obtain the 12 lead by selecting the 12 lead button. The monitor will then ask you for the patient's age and sex prior to obtaining the 12 lead for computerized interpretation. After completed, push the dial for enter. The 12 lead may take several moments to process, and it may ask you to accept the reading when there's too much artifact or cancel. If the reading has a lot of artifact, attempt a second 12 lead. To obtain further 12 leads, just select the 12 lead button again. Multiple 12 leads, sometimes referred to as serial 12 leads, should be taken every 5 to 10 minutes. This is so they can be looked at for trends and changes. When the paramedic has arrived on scene, or you have arrived at the hospital with your patient, present the 12 lead with your patient assessment to the provider. Leave the 12 lead in place on the patient during transport. Many monitors will automatically capture a 12 lead if they sense a great change in the rhythm. Once at the hospital, the stickers and leads can be removed after providing your handoff report to the receiving staff. Just remember to inform the hospital staff that you are a BLS unit so there is no confusion. As we know, not all of our patients look alike, and people come in different shapes and sizes. Take the time to appropriately palpate and find your landmarks when placing your leads. Haphazardly placing leads on a patient won't result in a great picture. So you might be asking yourself, how will I know what I'm looking at? The fact that you obtain a 12 lead is excellent and helps with overall patient care. Interpreting or changing the level of care based on the 12 lead is outside the scope of an EMT. Having a high quality patient assessment is also important. A 12 lead can give plenty of information, but remember there's also a patient attached to that monitor. Is the patient presenting with any signs of shock or hypoperfusion? Are they hypotensive? Have altered mental status? Is their skin cool, gray, or clammy? Are they diaphoretic? All of these things help with our clinical picture. Has there been any changes in their complaint? If they were experiencing chest pain, has it gotten increased or decreased? Palpating the pulses and checking for regularity, rate, and strength. These are all important clinical pieces that are a part of the 12 lead. Early acquisition is imperative for great patient care. EMTs can play a critical role in 12 lead acquisition. Thank you everyone for joining me. If you have any questions, please let me know.